Hi, everyone. I wanted to highlight what I thought was, public knowledge and what I think is very important for people to know. And that is that there are millions of people who are suffering from disorders such as depression, anxiety, severe OCD, and may or still not be aware that beyond the usual medication route, there are options. There are options that are far more effective. And you may have seen me speak and discuss the use of neuromodulation with a type of treatment called transcranial magnetic stimulation or TMS before. But what you may not realize is that there are now very well-known people, actors, executives, those who have been there, done that. They've tried, hundreds of different strategies, different medications, and they found that TMS can be very effective and, relatively speaking, far less invasive without really any side effects. Just to name a few celebrities that you may have heard of, comedian Neil Brennan has spoken publicly about his TMS treatment, saying that it has helped him more than any medication or therapy. Best-selling author Jenny Lawson discusses her experience with TMS in People magazine interview, describing it as life-changing for her depression. X Factor finalist Christopher Maloney has talked about undergoing TMS for depression, and there are many out there. There are many celebrities, well-known people who have come out and spoken on this. Tim Ferriss, on a podcast, clearly describes his experience with OCD and his relief with transcranial magnetic stimulation. These are people who, their livelihood depends on being awake, alert, fully energized, and having well-functioning brain to conduct their daily activities, work, and other tasks. These people are in the public eye almost all the time. So they're being scrutinized. And there are probably countless and many others that have also undergone these treatments with success. What many people may not know is, what is TMS and how does it work? So transcranial magnetic stimulation is a form of brain modulation. What do I mean by that? Brain modulation is simply a strategy to modify or modulate the activity, the electrical activity of neurons, of brain cells. And really, it's all about electricity. It's all about the currents that flow from one area of the brain to another, networks, as we call them. And it has been shown very clearly through well-done research that the connections between distinct areas of the brain, for example, the anterior cingulate and the dorsolateral prefrontal cortex, different parts of the brain, have electrical abnormalities that don't allow normal connections. And this is very true of many patients who suffer from severe depression. So TMS uses small electromagnetic pulses to increase the electrical activity, to put it very simply, in certain regions of the brain, thereby increasing the bond or connections between two different regions. In many ways, people have described it as re-energizes, awakens neurons, and it does this all without any pain. As you may have seen on YouTube videos or other social media, where comedians, actors, and other celebrities discuss it, it sometimes feels like a little tap or maybe a woodpecker, as was described by Neil Brennan on the Joe Rogan show with respect to how it feels. And it is very much non-invasive. There's no insertion of electrodes or surgical procedures done. Now, there are other mechanisms by which TMS is thought to become effective. The studies show that it increases neurotransmitters. It does increase blood flow to certain regions of the brain. It actually has been shown to increase the formation of new connections or synapses between different parts of the brain, which is in large part how this technique has been also studied for treatment of memory disorders such as dementia and Alzheimer's with success. And I touch on that in other YouTube videos and educational material. What I have seen in my clinic, that if TMS is done properly, and I personally use biomarkers with EEG, MRI navigation to really focus on specific regions of the brain, anatomically and precisely, you could have greater than 90% success. And that number, greater than 90%, is unheard of in the medication world. The best the medications have been able to achieve is between 30 to 40% success rate. 90% is unheard of. Those are the numbers that we are able to achieve with these types of brain modulation. And many patients ask, well, how come no one has talked to me about this? How come I didn't know about this? And this is exactly why I'm troubled by this, and why I'm making these videos. Perhaps it's because the manufacturers of TMS machines do not have the budget of big pharmaceutical companies to advertise or market or talk about these types of treatments on the usual platforms. And also their budget is far limited with respect to conferences, and of course they don't have the dominance that pharmaceutical companies do. Regardless, we are not trying to downplay the use of medications. Medications have their role, of course, and they do play a big role. However, when the medications fail, or if patients are either sick and tired of the side effects or they're just not having any benefits, TMS, transcranial magnetic stimulation, a form of brain modulation, has been proven to be very helpful. I touched on some well-known celebrities, and there are many, many out there, some who naturally do not really want to be in the public eye discussing their personal health history, some who have been brave enough to do that, such as Neil Brennan, as we discussed. But there are high elite professionals and athletes who are doing this. You should too. And this is often covered by health insurance. If done right at the guidance and direction of properly trained physicians and technicians, this can be done very well. Again, I talk about what makes a good TMS clinic and my other videos. Please see that. It is just like anything else. You have to do it right for it to work well. And if you have not had success with TMS, it may have not been done with all the little details that can increase and enhance its effectiveness. So I encourage you to learn more, and do not lose hope if you have these conditions. I've had patients who were battling these disorders for decades, and they are seeing flickering lights that turn into a big bright light at the end of the tunnel, and they have their life back. Thank you for your attention.